So for our virtual meeting, I need to read this segment, and it's pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law 330A 18, and the governor's March 15th, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the Southborough Board of Health will be conducted via remote participation by the members of the public and or parties with the right and or equipment to attend the meeting, and can be found on the Town of Southborough website. For this meeting, members of the public who wish to watch or participate in the meeting may do so in the following manner: by finding the meeting link on southboroughtown.com, remote meetings. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via telecommunication means. In the event that we are unable to do so, despite best efforts, we will post to the Southborough's website an audio and or video recording, transcript, and or comprehensive record of the proceedings as soon as possible after the meeting. Okay, now we can call the meeting to order. Did everybody get the agenda and materials for the meeting?
Yes.
Yes.
Good. Okay, great. Paul, could you give us a brief overview of our meeting today?
Sure. Other than the approval of the August minutes, you can see that on the agenda there's a lot of items. I'm not sure if we're going to be able to get through them all within 1 hour. I'm not sure if we're going to be given more than an hour, since already we've lost 11 minutes due to my inability to get on. But most of it pertains to, again, our discussions we've had very little on about reorganization and staffing needs in the future. And this was brought about, this agenda was brought about because of the fact that we have to, the Board of Health and all board departments are going to have to prepare a budget very shortly for fiscal year 22, which will start on July 1st of 2021. But that's when these budgets have to be prepared. The selectmen will sign the warrant for the town meeting, I think sometime in January, but there'll be a lot of meetings that will have to take place with you board members and myself and other staff members, with the personnel board, the advisory committee, and possibly Mark Purple, Brian Valentine, and others who constitute the town's economic and fiscal interdisciplinary group. So with that all being said, we can just go through the agenda, Mary Lou, if you want. I got it. This agenda is such that what I'm looking for, hoping the board will do today, will take up a discussion on the items on the agenda, specifically whether or not you want to create the position of a full-time public health director starting July 1st, 2021. Whether you would like to vote to move the position of the administrative business administrative assistant or business I'm not sure what these titles get changed so often. Barbara's position to a full-time position from 26 hours currently. The other positions which we should put into, at least get the order into the personnel board, is a creation of a full-time public health nurse, at least get the position in there. And also the creation of another part-time public health nurse. And then if you so see fit, to create the position of part-time agent, special projects and continuity and continuation of operation. That's a long way of saying it's just a part-time agent to continue with the special projects that we have in every year. There's always 1 or 2 or 3. Currently, we got a couple on the books right now that we're working on that we're never planned on, never budgeted for, but they always pop up. So that's what I would like you to go over today, if you can. There's also items that Emily would like to discuss and bring up to the attention of the board. And then there may be some other business items.
And then just to add to the agenda for everybody, I had a brief conversation with Sam Stivers, who's on the call with us. And if he can have a few minutes when we get to other business, he's going to give us an update on what's going on with the transfer station.
Okay.
And I'm hoping that, I know we talked about it a couple meetings ago, is really looking at the reorganization of the health department and how can we adequately provide the 10 essential public health services, and now with COVID and any other added issues that come about from a public health perspective, how do we continue to do that? So that sort of was the impetus to all of this. And Emily, you took on sort of thinking about that as it reflects in the blueprint. So maybe, I know Paul outlined the positions, we all got documentation, what those positions look like, but maybe before we dive into that discussion, you can give a little overview of your thoughts of how we meet the blueprint and all of that. Is that something that would work for you?
I don't have anything prepared, but I do have my blueprint here with all my notes in it. But I can tell you that I haven't really had much time to delve into it.
Okay.
Much further than I see Julie signed on here. She's with the Academic Public Health Volunteer Corps. She's been working with us for the last month or so, just doing research on how other health departments around Massachusetts are structured and who their staffing is. And as you may or may not know, Massachusetts, every town is different. The way that they're run, the way that their health department is structured, both because of what the needs of the community are and what is determined by their legislative, their town meeting or whatever, how they want to spend their money. But I do think that we are seeing that there is much room for improvement in our structure. And I think what Paul has outlined reflects what we've come up with so far. So,
okay, that's great. We can talk more about that, but let's start first. Did everybody, Nancy and Dan, did you get copies of the minutes?
Yes.
The August meeting?
Yep.
Does anybody have any additions, edits, changes?
I don't.
No.
No. So I would like to propose a vote to accept the minutes of the August 28th meeting.
I will second that.
Third.
All in favor?
Yes.
Yes.
Okay, great, super. So now I guess let's start discussion on the reorg, and I don't know if it's Paul or Emily, either or both of you chime in at how you came about the recommendation for the current positions that you've proposed.
Okay, I can start, I suppose. And what I did is really just take the current structure of the Board of Health and thought about how we could modernize or improve it to more adequately address crisis like either epidemics or pandemics, and more particularly leading eventually toward full accreditation, which is something we talked about many years ago when Louis Faison was chairman of the Board of Health. We were trying to think about ways of how we could get to a full accreditation and get the Board of Health to be, quote, a certified public health agency. There are very few public health agencies in Massachusetts that are certified. There's several in the country that are, but there's a lot which we don't have time today on this meeting to get into all the requirements for full certification. But it involves credentialing of the staff, particularly the public health director and other administrative and inspectional staff and nursing staff and so forth, which the blueprint lays out, meeting certain standards that have been enumerated by the NATRA, which is the National Association of City and County Health Officials, and this collective organization at the state level with many health organizations that came up with that blueprint. It's a very comprehensive document. And so what I thought was the first thing to do would be to get a full-time public health director with proper credentials, meaning in other words, somebody who has either a master's degree or a PhD in public health or some related discipline and multiple years of experience. And that's where we can talk about all of those sort of things. What kind of experience would you be looking for? How many years, and so forth and so on. But that would be the first order of business, to just, at least at this point in time, you decide whether, in fact, as a concept, is that something you want to move toward? Because before you know it, November will be here and we have to prepare a budget. Board of Health has to prepare a budget. It can be modified. It can be changed between now or November and when the budget is submitted and January. But once it gets locked into the town meeting's annual warrant, once the warrant is closed, it's very difficult to make changes at the town meeting, at the legislative body's floor. So this, before you know it, these months will move by very, very quickly. And so that was my whole idea of getting at least the concept of a public health director, fully credentialed, fully qualified, and then meeting with the personnel board to get the position established in the salary administration plan.
Thank you, Paul. Can I just add a couple things? We've looked at this from a few different directions, but I think if we're looking at it from like a resident's point of view, we need to be more accessible as a department and a Board of Health. I think not having people even in the office full time is an issue, like that. That residents can't get in touch with us to, call in or come in, when pre-COVID, not being able to come into the office, anytime during business, like regular business hours. I think that having that accessibility and that visibility for residents is really important. And I think we're not able to do that with the current staffing structure. So just to bring it down to simpler terms, but that's all I have to say right now. Sorry, there's a lot going on at my house. I'm getting a washer and dryer delivered right now.
No worries. Dan or Nancy, do you have any thoughts or questions for Emily or Paul?
No, I think it's a great idea. I do see a need for us to be open a little more and more accessible. And I think if there's, a time to increase our staff, now would be a good time, given it's the middle of a pandemic and people might be a little more open to seeing the need for increased staffing, given all that's going on.
Yeah, and I would echo that. also the need for, full-time office hours, but I'm also wondering if that warrants, a full-time director, a full-time nurse, a part-time director, a part-time nurse. So just because we need the extra hours, do we think that we need all those full-time positions? And if you do, then to Nancy's point, this is probably a good time to do it.
We definitely
mean,
do. We
no
need to
harm
grow.
in shooting. Oh, sorry
Right.
to interrupt, but
No, that's right.
no harm shooting for the max, and then if we have to scale it back,
Yeah, right.
so be it. But because I kind of agree. I mean, if you count the hours that we currently do, and then what we're asking for, it's a pretty big increase, at least from what I'm looking at. And where does Dennis fit in all of this? Is he?
That something that I mentioned in that structuring plan.
Right. Yeah.
Very briefly, not I put at the end of it, item number 5, part-time sanitary inspector. Again, for some reason or other, it's a little obscure still in my mind as to why we had to go out to bid as a consultant for that particular position. It was going to be part-time, less than 20 hours a week. And it was at the point where I was going into retirement mode.
Right.
And I was full-time at that point. And the board talked about having me stay on for about 15 hours a week, thereabouts, as the part-time public health director, but that a lot of the inspections and soil test witnessing, especially, which takes a lot of time, review of plans, permits, and the inspections of all of the sanitary codes that we have to comply with, both DEP and Department of Public Health, was felt that a part-time sanitary inspector would fill that role. And the reason that the town, other officials felt that as much as possible, they would like to minimize full-time positions because of the onerous, as they put it, requirements for benefits. So we did that with advertising, going out to bid for that particular position. I'm not sure why. I've never been clarified. Vanessa at the time explained that that's what had to be done, but yet we've never done it for a public health nurse. We didn't go out to bid for that. We didn't go out, with Leslie. So I'm not sure why, but anyway, what I would like to have us discuss with the personnel board, and they now have the town has an attorney that specializes in personnel matters, so that they don't have to go to Aldo Cipriano all the time. They get items presented to that attorney. But that may be something we may want to touch base with to find out, do we have to go out to bid on that particular position? Does it have to stay a bid position? Dennis submitted a bid. He was the only one that submitted a bid after we advertised in the paper and on bulletin boards and so forth and so on. And we had a 3-year contract with that particular position. And his submission was submitted to us in a timely fashion. He met the deadline, but it was right at the time when the COVID pandemic hit. And we also found out, waiting for a response from town council, Aldo Cipriano, as to review of my contract and Dennis's contract. Aldo informed us that the Board of Health language in Chapter 111, Section 27 of the Massachusetts General Laws, the language specifying allowing boards of health to have contracts for employee contracts, was eliminated. And he didn't know why. I talked to various people like Cheryl Sabara from the Massachusetts Association of Boards of Health, Don Sibber, others and so forth, and they could not figure out what happened, why that language. They said it may have been moved to another statute, and it had something to do with the reorganization of boards of health in 2019. So anyway, we were sort of up a creek without a paddle, and not even a canoe or a boat. We were just sort of in limbo. So Vanessa came up with the idea that we could, through that personnel attorney, that the board could enter into a letter. And I forgot, Barbara, I think, knows what the.
It was like an agreement or
Oh,
something.
right, okay.
Yeah, continuing agreement or agreement to hire.
Engagement.
Engagement, yeah. Because the Board of Health does have, in the statute, still had the power to, appoint any staff.
Right.
Just that you couldn't enter a contract. So you could appoint Dennis as sanitary inspector. You could appoint me as agent or public health, whatever. And of course, you have appointed Emily as the nurse, public health nurse, and now recently per diem nurse.
Right.
So it would be my recommendation that you would stick with some kind of a sanitary inspector, because that position entails going out and witnessing
Right.
soil tests, which is doing all the Title V. The Title V, as you, Julie, I have prepared an excellent pie chart showing the percentage breakdown, which graphically shows where we spend our time, where the Board of Health spends its time. And the bulk of that is the huge part. We don't have, unfortunately, that chart in front of you. We hope to get it to you very shortly. But it shows the biggest percentage of our functional duties are with Title V code. Not only with septic system, but all the administrative things that go with the Title V code, with the fact that before you can sell your house or buy a house, you have to have an inspection done and so forth. I won't go into all that, but there's a lot with the Title V code that we do. And
But so you think there's room for a full-time public health director and continue with Dennis as a contract sanitarian? And it just seems like a lot to me, but I mean, you guys know whether or not.
Wait, that's what I just said, and you wanted to shoot for the moon.
No, I heard you. I'm just doing the numbers in my head, and I don't know how we're going to justify all these new hours. That's all.
So I can speak to that a little bit. So even without having my COVID hours, I could fill 40 hours just by myself with all.
Oh, I'm sure. Yeah.
I worked 60 hours the week before last, 68 hours
Oh, right.
last week. So
I'm not really,
You
no,
worked
but the
60.
nursing part, it's more the public health,
well, there's
director.
a few pieces of that we've sort of not been active in, and it's really been highlighted with this pandemic, with this health crisis, particularly the emergency preparedness piece. We do have and have had an emergency preparedness council in town, but there are quite a few resources within the state where we could be getting more funding and utilizing those both financial resources and experiential resources if we were more involved with those groups.
Oh, I see. Yeah.
So there's a group called the Public Health Emergency Preparedness Coalition, which is a group of 60 towns, Region 4AB, which has been an excellent resource for me coming into this, and probably other, public health people in that group because of COVID. That it's a lot of, talking with each other, seeing what other towns are doing, how the information is being shared both among public health people and with residents. So before, we didn't have a seat at that table because the hours that we have are so limited that we weren't going to those meetings, and we weren't capitalizing on those resources that they were offering. That's just one example. Another is like the Tobacco Coalition. I know Paul and Leslie, who was here before me, were involved with that, but there's so many other pieces that we could step into, and our town could benefit from that. I mean, I don't have a list in front of me, but those are the two major ones that I can think of that are not COVID related necessarily. So like even without COVID, the Emergency Preparedness Coalition, it offers us things that help with flu clinic and then other, emergency type preparedness drills and stuff like that.
Gotcha.
And
That's
Emily,
the big one for me.
Emily,
Yeah.
do you see that full-time nurse position sort of managing or having oversight on that emergency preparedness team?
So I have been going to their regular meetings and being really involved in that groups, just because I want to learn more about how it works and
Sure.
what
Yeah.
we can take from it. So
And can you guys
That's-
correct me if I'm wrong, but has that team that we have in town, have they been kind of either non-existent or it hasn't been as much presence, or they haven't had as big a large membership? Because wasn't that guy Neil in charge of it, and now he's moved away or something? Am I on the right track here or no?
Are you talking about the CERT or the, he was Neil Laspacey?
Yes. Right.
He was in charge of the CERT program, which is the program that basically attends to emergency catastrophic events like a hurricane or flood, tree damage, things of that kind, tornado. They were organized to basically respond when there's a crisis.
Right.
The other is the nursing group, which is the emergency
MRC.
MRC. Thank you, Medical Reserve Corps. And again, that has not been that active because there hasn't been a crisis except for just right now.
Yeah.
well, I was going to bring up the MRC in my point on the agenda, because that also, we need to work on that. As you may or may not know, it was developed after 9/11 in 2001. And I believe, Nancy, you had been a big part of bringing MRC to Southborough.
With
But,
Leslie.
So now the MRCs, like all the towns and different jurisdictions, that they are organized as an arm of this Public Health Emergency Preparedness Coalition, and they are essentially run by a state agency through MA Responds. And Southborough has not been active in rostering residents to be part of the MRC. So we have our own roster, but we actually are not part of the larger MRC group. But even having our own in-town roster, it's not that robust. Like, that's something that we should develop, and people can be part of these trainings both locally and through the state group as medical providers, but also the CERT people who are not medical. They're more, a lot of them have like military background and emergency responding backgrounds. But I think that's another place that we could, be beneficial to have more, employment hours to beef up our town volunteers. I don't know if you want to hear more about the MRC thing, but I would like to get your opinions and see if you are in support of us rostering our MRC people through the state channels, the MA Responds, and having them rostering them as being true MRC volunteers. What I was told from our coordinator, our MRC regional coordinator, is that, sorry, I'm listening to the people putting in the washer and dryer. So what they're telling us is that we can't use the name MRC if we're not rostered through the state mass response, MA response. So we would either have to just be our own CERT group, or we would have to, you know, go the correct channels in order to have it be a true MRC.
They don't make it easy.
I know.
Jeez.
Well, to Emily's point, is that, Nancy, is that there's now, like, when this started back in, was 2001, was it? You know, it's evolved over time, and now it's a pretty robust statewide group, and so why wouldn't we want to benefit from that, as opposed to
sure.
having our own separate sort of independent? And like anything else, you know, if you're part of a larger, you have the resources and the access to greater information, more sharing, all of those things. Versus you're in a standalone and you have to figure it all out for yourself, and oftentimes recreate the wheel a lot. So that's, you know, that's one of the benefits to that.
And it doesn't necessarily mean that the Southborough active members have to respond to state emergencies or anything like that. It's just, you know, they can choose to be on a listserv that just is for our town, or they can expand it to, you know, what other opportunities there are. But I think going the right channels, it gives everyone, you know, the coverage and the information, and then we are eligible for whatever resources the region is providing, whether that be the training or the doing the background checks or whatever other informational and financial resources they can provide.
Sure.
Well, and also if there was a disaster.
And it doesn't cost us any money,
Yeah.
except for
better.
hours, except for my hours or the department.
Right, for the hours of the person. But, you know, it also helps if there really was a hurricane or a tornado or something. You have a lot of other people chipping in to help, versus when you're in a standalone, it's the access to other help isn't as readily available.
I understand.
Well, and this all comes to a head when we're looking at the emergency dispensing site plan, which could come into play for a COVID vaccine. So we're really looking at updating that and making it relevant and having the manpower behind it to be able to support the response. So that, I mean, it all comes together in that it,
Sure. Yep.
you know, it's all coming to light because we are actually looking at using it. So, but we should have been looking at that all along, you know.
Right.
I know.
Myself, I, between two departments, I do a lot of Board of Health when I'm at the assessors, because I get the calls in for Title V's and information. So I juggle two jobs most of the time, but I do more Board of Health. There is a lot to do down there. I feel sometimes like I'm strapped, and I have to drop everything, and I have to do abatements or deeds, which I love the assessors. But I just think too, where the work I do at the Board of Health is under the title Business Administrative, because I do payroll, I do payables, I take care of a lot. When I go up to the assessors, I'm an admin assistant. So one, I'm doing a ton of, you know, the workload, and I'm just getting paid for the administrative assistant. So that's why because it is technically for the Board of Health, a business administrative.
Yeah, absolutely, Barbara. And, you know, and the licensing, you know, different licensing and,
oh my God. Yes.
and, you know, and permitting, and all of those things fall on that position. So, as Sam's going to talk about, you know, one of the additional roles and responsibilities might be related to the transfer station, which I'll let him give you that update on, but that's even additional kind of licensing work. So I think we've all, in reviewing the blueprint, looking at what the pandemic has really brought front and center, is that we've been kind of just doing the minimum. We've been getting by and doing what we needed to do, but now we should be prepared for an emergency, and we should be adequately prepared and staffed. We should be able to stay ahead of things, and Barbara shouldn't be doing Board of Health work when she's in a different job. It's like,
That's true.
Paul or Emily doing work, when they're not logged into work. I mean, it's we should be supporting ourselves, and so I think the positions have have evolved, and coming to that that revelation that, and maybe it is reaching for where we think the maximum, where we could provide the best service to Southborough from a public health perspective. And if we have to scale down because the budget isn't there, we may have to revisit, but let's shoot for what we think.
Sure.
Have a not an excessive, just a board that's going to be able to provide the 10 essential services and do it well.
One of those 10 essential services is disease prevention. Prevention, generally, we've never been in the realm of prevention except for maybe to a very minimal degree with water pollution control with the septic thing, preventing massive pollution. But otherwise, as far as disease prevention, we're a reactive board. We basically react to the crisis as they come up. And I think the blueprint speaks about that's generally been the realm of a lot of boards of health in this, not only in the state, but even the country. They're minimally funded, very, very minimally funded. And especially those in Massachusetts. We get no state money as such. There's a grant that comes through now and then for tobacco or one special program or another, but it's here today and gone tomorrow. There's no sustainable funding other than the taxpayer and the permits and fees that we collect. And that can't, the fees that we collect, a lot of people, they call the office. The phone rings not incessantly, but it rings quite a bit. And it's not just a quick answering but people want things to be looked up. They want us to research, go into the file, look things up, get back to them. But that all takes time. And that's a lot of time of Barbara's time. And she has to track all the income that comes in and payables and so forth to make sure that everything is done according to what the requirements are for budgeting and so forth. So I can go on and on and on, but I mean, it's the board has been minimally funded, and it's not the fault of you, the Board of Health members, or even the town. I think the town has been very good, all things considered, compared to some communities. But I blame more the state putting the requirements and codes, regulations, Code of Massachusetts regulations on cities and towns without there being adequate funding.
And I think it's my understanding that because of COVID, the state has recognized a lot of the gaps, and that's part of the CTC, which has been providing contact tracing for COVID. The reason that was even put in place by the State Department was because a lot of cities and towns don't even have any nursing hours. So they had no way to do contact tracing, even though each city and town was supposed to be responsible for that. And so they've realized this, and it's my understanding that there may be money coming out, and we may learn of that along the way as we go, for health departments to support the blueprint activities, as well as there may be some legislative changes that allows more cross-jurisdictional working. So allows us to work across jurisdictions more efficiently and effectively. That's remained to be seen. It's not current right now. There's no regulations changed at this point. So I think we need to move forward. And if that happens, then maybe we can share responsibilities with other towns. But as you know now, sharing responsibilities across municipalities is very complex and very challenging to do. So I think it makes the most sense for us to move forward in what we need in Southborough. And then if those options come up in the future, then we can revisit it.
It's a very good point that Mary Lou made, and I would like to reiterate expand upon that. In other words, when I laid out that so-called restructuring, what I did was come up with what I felt, and I wanted the board to react to it and give me your thoughts, what you're doing. A structure of what we felt was minimally needed for a Board of Health to be operational in Massachusetts, for the town of Southborough. I don't at all think that this could adequately be funded, or the town doesn't have the money to fund. I mean, you're talking about a lot of money for salaries and benefits and so forth, and your property taxes are high enough, and nobody wants to see your property taxes go up anymore. But my feeling was that I think, and I could be wrong, but I think I hear rumors that there could be more money coming along, possibly both through the state and federal government coming along in the future. But if we don't have, at least in concept, the structure laid out, then it's going to be inadequate to try to rush to try to fill all those positions. A lot of them could be just positions on the salary administration plan, but that has to be voted at the town meeting. And if you don't have a position in there, that's one of the things that, it's like, well, there's no position. So you have to wait for a special town meeting or the next town meeting. And of course, to remind everybody, we're preparing a budget now because we're asked we have to get it in. And I don't know what's going to happen with state funding or the CARES Act, or what the federal government is going to do. If anybody has a crystal ball on what's going to happen with the presidential election, Pelosi, and all what they're trying to do and so forth, I have no idea, and nobody does. But I think,
so, not to interrupt, but I'm just afraid we're going to run out of time.
You're right.
What do you need from us today to just give you our approval to look into doing the budget according to this new structure? Correct?
Yeah. Yes.
Do we need a motion for that, a vote? What do we need for this?
Well, I think at least motion is this the concept that I laid out in that restructuring. Is at least you could vote in concept. You don't have to necessarily even,
Yeah, well, I would make a motion I think we should go for it. And you do a preliminary budget, right? Like they give us, like we can go back to the table with a reduced budget. Hopefully they're not watching YouTube. But I mean, I think we should go for what you who are working in the office, you, Emily, Barbara, Dennis, I mean, you see the needs probably a lot better than we do. So, I mean, I'd be willing to make a motion or just give you my approval to proceed with making a budget according to your plan.
okay.
So what do you think about this, Nancy? I'll follow through with your motion in a second. Is that we make a motion and we vote to move forward on a reorganization structural plan.
Okay.
And then Paul and Emily and Barbara, we can work on the structure of those positions, because you got copies of the positions, you got copies of the job descriptions. I think we're going to have to come up with, which is going to take a little more work. So maybe at the next meeting, Emily, you can give a more comprehensive sort of impact statement of why and the why behind each of these positions and the roles and responsibilities in order to accomplish those that will help us, and then work on a budget of what that would look like. But at least it'll move the process.
Sure.
Okay, so if we make a motion to move forward on a vote for a reorganization of the Board of Health.
Second the motion.
I
Dan and Nancy, and I should have said this too. This is Mary Lou Woodford, and I am making a motion to move the Board of Health to a reorganizational structure and proposal of the positions that's needed for that restructure.
This is Nancy Sacco, Board of Health member, and I second the motion as outlined by Mary Lou Woodford.
Yep, this is Daniel O'Rourke, and I third the motion.
We agree.
I know, I wouldn't know
I'm in
either.
agreement.
So all agree on the motion, and now I'd like to move to a vote. This is Mary Lou Woodford, and I vote yes to approve that motion.
And this is Nancy Sacco, and I second the approval.
You're voting yes.
Yes.
You vote
Yes, aye. Yes, aye. Woo-hoo.
And this is Daniel O'Rourke, and I vote yes.
Okay.
So Paul, when you come back from vacation, we have to work on the budget because we have to submit it by the 30th of October.
Ooh.
I'll start working on it, but then you and I can work on the bigger parts, okay?
Yeah, I can email you or text you from where I'm going to be.
We'll have time when you get back, though.
Yeah, okay.
Emily, are you okay with that? Giving us a broader overview of some of the work and some of the work that Julie's done and all of that? I think that would be really helpful.
Definitely.
Okay.
Can we set a meeting date now so I can make
We
myself a timeline?
Absolutely. Before we adjourn, we'll do
Thank
that.
you.
Let's see. I think we covered everything around the restructure. Emily, you wanted to talk a little bit about some of the impacts of COVID and some of the work you've been doing?
Yeah, I just, there's a couple things that have come up over the last month or so. I get a lot of questions about case reporting for COVID and, you know, suggestions on how we should and what we should include, and people want more details. As of right now, we're just reporting on the town website the total number of cases, how many people are active, how many people have been discharged from isolation, and deaths, along with a breakdown of ages of cases. I think that's just like the very general information, and I think that's good because it, you know, protects patient confidentiality and all that. The school district has started doing a dashboard on their website and for their community that includes how many people are on quarantine, was it community transmission or community exposure versus in-school exposure. It's a nice dashboard. I'm just wondering if you guys have put any thought into how you would like to see our town numbers and what you would like us to be showing to residents on our webpage. But that isn't just for residents. Anyone can access our webpage.
Right.
Emily, I have a question for you.
Yeah.
Because somebody brought this up to me, and it was in regards to Southborough being in the red.
Mm-hmm.
And they said, well, it would be nice to know, and I think this is somewhat around in regards to the dashboard for the school. It would be nice to know if you could categorize it in terms of number of households, versus, you know, because there's whether they're kids that are boarding at St. Mark's or Fay, and then maybe another question is if you have a child that goes to college, you know, maybe not even in Massachusetts, but their permanent residence is in Massachusetts and they're at college. And in colleges, if you are tested positive, you go into a COVID dorm, but you stay on campus. Would that kid count towards Southborough numbers? And then getting back to, you know, because if somebody is in a household gets it, well then, you know, other people in the household are going to get it and probably have. I think that's actually a fact. So, you know, if we've got 13 active cases now, well, 4 of them could be in one household. And I think it's just to put some minds at ease a little bit, because they're, some people see, oh, we're in the red, and their anxiety levels might go up a little bit, and maybe, and this came from somebody, that I talked with, and they were like, oh, well, if we knew that 4 of them were in one household, if we knew the number of households versus the number of people, that might put their mind at ease. So I don't know if that makes sense, or if it's possible, or what. So I'm just wondering how that would work.
I don't know how we would do that, but you're right. It does spread in households. So
You probably
I
don't
can
even
look
need an
at how-
answer now.
Right. I can look at how other towns are doing that, if they even specify that. But I mean, I can answer you. Yes, if it gets into a house, it typically will spread in a house.
What about the college student?
So the college
description?
student piece. So college students are not counted in our numbers if they are a full-time student at a university, or college. So if they're out of state, they get transferred back to that state. If they are in state, they get transferred to that jurisdiction. Some people, some colleges are actually sending people
home.
off campus, which I think is just not the right practice, because that's taking this virus from one community to many other communities. Like, just keep it where it is. Try to contain it within your community, not make it affecting a broader, multiple hundreds, even possibly, depending on how many cases you have that you're, pushing out of your campus or your surrounding areas.
Yeah, Dan, in the COVID work I've been doing, it's the reality, the whole college thing, and I think that's playing a role in some of the numbers that we're seeing, because every college is different, every university is different. They're not all having separate quarters for their students. They're sending some students home, some students are choosing to go home. It is all across the board. There's not a uniform standard way that each school is dealing with this.
So if a kid is in school in a college outside of Massachusetts and then gets sent home here into Southborough, are you notified, or is the town notified of that, and that goes towards our number?
So we are notified of any case that it has an address of Southborough. So then we have to investigate that case. So we call and we figure out what their situation is. So if they are a college student, what the state of Massachusetts is telling us to do is to classify them under the jurisdiction of where that university is. So we may follow them, but the numbers will then go back to where that.
But even though that college student would be coming back to live at home.
Yes.
Because the college sent him home.
Yes.
Or the student chose to come home.
Right.
Yeah.
Okay.
So I think we're still learning with the whole college thing, and we keep track of their secondary address, which in this case, if they went to school out of state and then they came back to quarantine at home, that would be the secondary address noted in the file, but it's not counted, I guess, for a COVID number. So, the COVID counting is a little complicated sometimes. It's not as straightforward as it seems. But I think it would be helpful, Emily, to know some of the questions you've got from residents saying, what are these numbers? What are those numbers? Besides the household issue that Dan brought up, are there other data points that the residents are asking for that we don't report on?
Well, prior to the school district doing a dashboard, it was, are these students in a school? We're seeing an uptick in the number of under 19 or 19 and under. Are those college students? Are they students in the school? So, I mean, I didn't feel like I could give that information necessarily to an individual resident.
Right,
So,
right. And the other
and they're
piece-
more suggestions, like it's not
Right.
tell me, it's could you include this in a report?
Right, right. And the other piece that's come up in other towns that we might want to think about is now the daycares have reopened. And now that like preschools and nursery schools have opened, where do they fit in the structure? Because a lot of them are private, right? So,
Mhm.
you know, we don't report on those at this point.
No, it is as important as contact tracing is. I think respecting people's privacy is also very important. So, you know, you've got to, you know, do as you're doing and being respectful of that as well.
Oh, absolutely. Yeah, there's no question. And when you have, you know, 1 or 2 cases, you kind of can't report because it's, you know, it's a cell size issue and it breaches that possible confidentiality and privacy piece. But we can look at, Emily, could you look at maybe what other towns are reporting and if there's something maybe we should consider from a reporting perspective?
Yep.
Just add it to your list.
Yeah, I know.
And we're
I got a whole bunch of check boxes.
Right.
Yeah.
Sorry,
speaking
were you going
of
to say
adding-
something, Paul?
Yeah, speaking of adding to the list, I'm not sure when we're going to be cut off.
We're not going to get cut off, Paul.
Oh, we're not?
No.
Okay, good. And you wanted to make something about Sam Stivers?
Can I ask Emily one quick question?
Yeah.
We're gonna start getting a lot of calls about Halloween and trick or treating.
Yep, that was going to be next on my list.
Okay.
So I am starting to get questions about Halloween. So I wanted to get the board's feeling on what you want us to be responding.
Is there any information from the state?
Yes.
There
since
is.
So let's start with that. What is it?
That's what I've been pointing them towards. So it's the 6-foot distance, the gathering rule, the wearing masks, the face covering type, not the costume masks. So even if you're actually wearing a costume mask, you should be wearing a face mask as well. There's a few more things about
So the state isn't saying don't trick or treat.
no.
No, the
They're
state
saying-
is actually encouraging because the fear, and Governor Baker was on this past week, and he said that his fear was that if he said, you know, we're not doing trick or treating across the board, it would increase the number of in-house parties
Oh, true.
and
Yeah.
inside parties because people want to celebrate in some way. So he felt like if there is some way we can do safe Halloween activities that are outside, that are socially distanced, that is the best route to go down.
And I'm
I
just
mean,
hoping
if we're
like,
going to do a holiday, it should be Halloween. It's outside, right?
exactly.
Right.
Just as long as you're following the, you know, the recommendations, the risk reducing, you know, mitigation strategies.
Right.
So
And hopefully people will be respectful of, you know, older people who turn their lights off and don't want anybody, you know, so they're going to go ahead with door-to-door trick-or-treating.
yeah,
Yes,
they're not
Right.
prohibiting it.
Yeah.
not prohibiting. There's a lot of creative things that are happening. Emily said,
Oh, that shoot. Did you
One-
see that? The
one
guy
res-
with the candy shoot.
I don't know. Yeah, that was cute. But there's also, one school did, I guess this has been around for a long time, but my kids have been trick-or-treated for a long time, so I didn't know. It's called Trunk or Treat. And you go to a big field and you open your trunk and people decorate their cars and kids go from one trunk to the other trick-or-treating. And the benefit to that is, you know, everybody in the circle. So, you know, it's only the invited people that are part of the trunk or treat thing. But I know Emily had a request from a young man who put a lot of time and energy into asking for the Board of Health approval for something that he was proposing. And so I think people are are aware and they want to do the right thing. And our role as a Board of Health is trying to give them the best guidance to be safe.
Yeah. People want normalcy as best they can get it, I guess, you know?
Yeah.
So what are we looking then? What are we going to do here?
Well, I'm not
Are we
going to
gonna-
abolish Halloween.
No,
Emily,
I'm not
you-
saying that. I'm saying,
What
and
guidance?
I'm with you, Nancy. I think we need to trick or treat. But is there a statement that the Board of Health would make?
Probably to follow the guidelines that
State?
Emily had just mentioned that
Yeah,
have already
okay.
sort of been,
Yeah, the
and
guidance.
if they feel uncomfortable, don't go. Like, no one's forcing you to trick or treat.
Mhm.
Right. I think the guidance that the state put out, Emily, is probably enough for you to give guidance to
Yeah,
people
I
if they're calling, asking for it. And if you ever feel like, I'm not comfortable with this, or I don't know where this fits, I mean, call one of us on the board. We're happy to brainstorm with you, or
Or make phone calls even. you
yeah,
know.
if you need more detail or whatever.
Okay, thank you. That's very helpful. So I will just write something up. We can put it on the website.
Okay.
Speaking of, town administrators wanted, have been talking with Paul and I about putting something out about being in the red because of our COVID numbers. They wanted to, we talked about putting out a statement. Just my suggestion was to, just acknowledge it, obviously, but then to try and encourage vigilance in wearing masks and social, maintaining social distance and,
Hand washing.
Yeah, I don't really know what more you could do. I mean, that's really, what else can you do?
Yeah, exactly. So I just reminding people that those are the things that will keep the numbers down.
Right.
So,
Yeah.
So I just wanted to bring that up, that they were asking if we or I could do that. So
Sure.
I'm planning to just put out like a 3-sentence.
Perfect. Short but sweet.
Well,
Or not
I mean,
sweet, but
yeah, short but like strong and meaningful. Like,
right.
You need to, watch your own activity. Like that's how this is going to get better, is by everyone following
personal responsibility here.
Mm-hmm.
Yeah, emphasize that. It's really a personal responsibility piece at this point. And for families who have teenage and young adults living at home, it may be a little harder for them, but ask those
Maybe
parents.
Real hard.
Yeah, asking those parents to get more involved in reinforcing that personal responsibility of everyone.
And also avoiding groups, large groups.
Absolutely.
Don't go.
Large groups and indoor are the two
Indoors.
things that are
Right.
really, really difficult. I did want to say that, just while we're in the meeting, before we go to other business, or if Emily has anything else, that Jim Haggerty has been very diligent in communicating with the board about creating a safe election environment. And so I really would like to thank him for really that due diligence and checking every little detail to make sure that the elections are safe for our residents.
Good point.
Sounds good.
And then I just had some good news about our flu clinics. We've done 2 so far. We have another flu clinic planned on October 22nd. And as the Board of Health, we've vaccinated 90 kids, and it looks like 81 adults. And then we partnered with CVS on the day of our school clinic, and they were able to vaccinate 86 adults. So
Wow.
we've
Terrific.
slowly but surely, we're making progress in flu vaccine, so
Good
flu
news.
vaccination, sorry.
Yep.
Yeah.
Yep.
Did you have anything else, Emily, before we move to other business?
Nope, just asking, I have on here to ask about the next meeting date, but you
Okay.
said you'd do that at the end, so.
Yep. Barbara, I don't know how to let Sam speak.
I think Tom, wait a minute, let me see, asked to him.
I got it.
Okay, thank you. Got it. He did it.
Sam, thank you for coming to the meeting today. It's always great when we have other community support for the work we do, and we appreciate it. I know you wanted to talk a little bit about the transfer station and the work that John Butler's been doing, and I don't know if anyone on the board has really been know what's happening. So maybe an overview would be great.
Okay, thanks very much, Mary Lou. I appreciate the opportunity to speak a little bit here. And the goal here is to actually update the board on some late breaking activity relative to the transfer station that has implications for the Board of Health. As some of you may have seen, the Capital Planning Committee has been taking a look at transfer station as far as potential investment there to upgrade various things at the transfer station and figure out what's necessary, what our options are, et cetera. And they convinced John Butler, a former advisory committee member and other longtime participant in town government, to come out of retirement and do a study for us, transfer station. John did that over the summer and has given a report to the Capital Planning Committee, the Advisory Committee, and recently to the Board of Selectmen. And the issue was, do we need to spend $3 million to upgrade there? The good answer is no, in fact, which is encouraging. And the other question was, are there things about the transfer station that we need to fix, change, et cetera? Look at other towns, how they do that process. As many of you have probably noticed, the recycling world has gotten turned upside down in the last year or two as China shut off taking recycled plastics, glass, paper, and threw that world into a crazy tailspin where it now costs us more to get rid of stuff that's recycled than the stuff that's disposed of in the pit, which is crazy. And so we're trying to figure out the implications of all of that. And one of the things that's important is to have the data we need to renegotiate our contract with Wheelabrator, who takes the trash out of our pit and runs it through their waste to energy process. So that's a good thing to have. But their 30-year contract with us is now expiring in about 4 or 5 years here. And we need data to be able to make a good decision about what we want to do next with them. And John discovered that somewhere 20–30% of the folks in town actually use private trash haulers. And we have no data about what the trash volume is for the trash haulers. And state law allows boards of health to license trash haulers, and many towns do. And part of that licensing process typically is requiring an annual report of the tonnage that they pick up and dispose of at whatever disposal facility they use. And John's recommendation was that we consider licensing the private trash haulers. And Westboro, for example, does this, charges them $300 a year to cover administrative costs, and then gets an annual report from them that they use for their various analysis of their trash disposal services. So John's thought was that if we could collect that data, then we would have a more complete picture when we start negotiating with Wheelabrator or others to renew our agreement for solid waste disposal. And so I want to raise that question with you folks. I'm obviously not looking for any decision or analysis at this point, but wanted to make you aware of that report and the possibility of doing the licensing here and figuring out if there's a way we can do that that is workable for the Board of Health and gets us the data we need when we start negotiating the next contract. What I have is I've got a copy of that report that was provided to the selectmen, and I would be glad to send it to you folks to take a look at and come back later and answer questions or talk about next steps. But I just wanted to get that on your radar here to say this is something that could be very important for the town as we go forward. And I think we would appreciate any cooperation that the Board of Health could provide on that to help us get that data. And the other piece of good news, I don't know if I mentioned it, but our transfer station is actually working very well relative to a lot of other towns. We had people who have suggested a variety of things like pay as you throw or changes in the fee structure, et cetera. But when you look at other towns, we actually have a very low cost. Cost the average resident who uses the transfer station $275. Private haulers start at 400 and something up to 600. And so people actually get a pretty good deal. Some people are happy to pay for the convenience, but for most of the folks in town, it's actually a pretty well run and cost-effective operation, which was encouraging to hear. So that's, I guess, my pitch here is to alert you to the issue, send the report along, and then come back at some point later and talk more pointedly. You guys have a lot to do now other than worry about the transfer station. So wanted to at least get that inserted in the process. And I'd also reinforce that you guys are doing a great job under very difficult conditions, and a lot of folks very much appreciate the work that you're doing here to sort of keep up with the current crisis. And I certainly support your efforts to think about longer term staffing issues and a more comprehensive full service view of public health function, because I think this crisis has pointed out the value of having a strong set of skills and programs to support public health in town. And I think this is a great time to have this conversation. So I would encourage you to keep going in that direction. And I'm certainly very supportive of those efforts. So that's the quick and dirty version. Don't want to take up a lot of your time, but I'll send this report along and work to follow up as I hear questions from you or suggestions for next steps.
Thanks so much.
Yeah, thank you, Sam. Thank you for your support. It's always greatly appreciated. And thanks for the summary and the overview. One quick question I have for you is, in that report, does it talk about how much of the disposal at the transfer station is recyclable versus trash? And has that changed over time? I know the reimbursement for recycle is really gone down crazy. And is that all in the report too?
Yes, a lot of that's in the report. I think it's about 20% of the tonnage that goes to recycle. We actually pay for recycling now.
Right.
Stuff. We don't get paid. It would be cheaper for us to throw the recycled stuff into the pit and have it burned, except state law prohibits that, so we can't do it. But
I wonder if it also breaks out compostable material.
Yeah, I think he has data on that. Compost, the landfill stuff and the leaves and organic bin there is, I think, was less than 10% of the total tonnage that goes out there. That's another hauler who takes that. Another hauler, Harvey, takes the recycle stuff. Wheelabrator takes the pit stuff. And so, again, we continue to look at the economics of those various things. And recycling needs fixing from another perspective in terms of not only the economics, but behavior. There's a fair hunk of stuff that goes in the pit that could be recycled. In fact, they've done a study a few years ago, I think, that showed something like 20–30% of the stuff that goes in the pit could be recycled under the old recycling rules. So we do a fairly good job. Other towns do better. A lot of towns do worse in terms of throwing the wrong stuff in the pit. But again, there's a lot of things that we need to look at there. But the big economic question for us is, how do we do a good job at the next solid waste disposal contract time coming down the road? If we make a good decision there, then that opens up a lot of other possibilities that we might want to consider for operational stuff. So overall, good news. Missing one piece of data that you folks could help us collect, and we will keep looking at that. But John did a great job, and the Capital Committee has done a good job focusing on some of those big longer term issues that are going to roll back into the tax base if we don't do a good job of controlling that. So,
and if we instituted I guess we'd have to do a regulation, right? For having a license for haulers that come into the town have to be licensed. And is that money that would go into the Board of Health revolving fund? Like, how would that work?
Don't know specifically. I'm assuming it could. Westboro collects $300 each. I don't think there are many private trash haulers, half a dozen or something. I'm not sure. So it's not a lot of organizations there. And you guys, I think, would need to, and I would have to talk to town council for sure, but I think you would need to have to vote to adopt the appropriate pieces of state law to allow the licensing, and then have the paperwork, which the state has a model licensing paperwork set that Westboro used basically, to put that into place, and then set the fee, the licensing fee, and then administratively collect the reports and hope ideally pass them along to DPW or whoever is collecting that for analysis purposes. So I think that's sort of the high level view of the process.
Thank you so much.
Thank you,
Yeah,
folks.
thank you.
Appreciate the hard work, and let's keep our fingers crossed on COVID.
Yeah.
Thank you.
Paul,
Yes.
thoughts, comments, anything addition you want to?
Well, just to tie in with what Sam was just mentioning, again, that's another administrative item that will probably end up, other than the initial organization of it and getting this program of licensing the haulers off the ground, which would just be a vote of the board. We'd have to, word the structure, the wording for your formal vote, but the actual work will fall predominantly on Barbara's lap. And
Right.
It's just another, we just keep on piling and piling up. I don't know how she does it. I think part of it is, I gotta compliment Paul Sabelli, who allows Barbara to basically do a lot of Board of Health stuff up at the assessor's office. Whether that should be said or not, I don't know, but thank God that's been a godsend.
Yeah.
Because it's one town, and she's working for the town. And if some of the things can be put off at the assessors, because we got so many crises going on in the Board of Health with so many issues. I don't even want to bring them up because I could go on all afternoon about all the other minor things that come up. But a lot of it is going to have to fall on Barbara's lap. But we can do it, I'm sure.
As long as
Okay.
it's not the actual trash.
Yeah. The other thing is, just to keep you informed, I've been, as you know, speaking of other duties, special projects, over the years, there's always been one or two. Some of you heard, we talk about the stinky streams of brooks and the outfalls of basically people doing stuff that they're not supposed to do. And we've had the stinky streams, some of which get solved, but some of them never get solved. We just don't know where they disappear, they go away. But the other issue we have right now, currently, that I'm basically collecting data information on that so-called Davis Farm dump, which I'll inform you about that in a little more detail as I go along. But I'm collecting information on what needs to be done, and that's going to have to be brought eventually to the town to see whether in fact they want to pursue cleaning that place up. And there's two options to clean it up. One is a little cheaper than the other, and I'll present all of that in the report. But ultimately, if the town ignores the cleanup, the state will probably send the DEP will send an administrative consent order. In other words, the town will be ordered to clean it up. And then if the town doesn't, it'll go to a court, and the court will probably mandate it because it's a state law, unfortunately. So what the cost is going to be, I don't know at this point in time. I think we'll have to go out and get some bids and so forth. But again, it's a detailed process. I'll write up more about it. You'll be hearing from me about that. But that's just one of what I call special projects. Those are things that we get 2 or 3 of these a year. This would probably be an ongoing project that will take several years. And the town does not have to. I don't think they're compelled, because we cannot at this time see any toxic or hazardous materials that are in that dump causing. We've tested all the wells that we needed to test in that area, and they've all come back clean. There's nothing on the surface that the reports from the LSP, those are the licensed site professionals, indicate that the surface leachate is relatively clean. There's 4 metals in it, but they're not anywhere near the maximum contaminant level. They're not even approaching that. But you'll hear more about that.
Okay.
Okay.
Thank you. I think our one last thing is to see if we can define at least a week for the next meeting, and then
Yep.
if we can.
I'm just gonna run and get my calendar.
Oh, that would be great. If we can get a date and time, it would be super. If not, if we can narrow it down to a couple days, we can send a doodle poll out, but we can get it on our calendar. What time frame are you thinking, Emily and Paul?
I'm completely open.
Like how soon? I guess how soon do we need
How
another
soon?
meeting? Is it in a month or is it?
I think,
When is the personnel board meeting? Because
When does the budget need
if
to
we
be
needed
in?
anything, yeah. That's October 30th I have written down here.
Okay.
yeah,
And then personnel board is, there is another date?
yeah, there is. I don't have that date in front of me. I know, as you know, Mary Lou, the new process with the personnel board is that the liaison officer will be visiting the Board of Health office, chairman, Board of Health staff, and any members of the board who want to sit down with that person. The person liaison with the personnel board is going to be Betsy Rosenblum, who's the chairman of the personnel board at the current time. Well, they don't have a date.
So I guess the question is, do we ask her to come to our next meeting? Or do we meet with her
You could do that.
individually?
You
How
could.
does that work?
Well, I think she was going to come individually. I thought, because if she could meet with just one board member, and you could, as chair, you can either designate somebody, Mary Lou, but if she meets with just one board member in a staff, then it doesn't have to be posted. It doesn't have to be a posted meeting.
Okay, okay.
And I think we could probably. I don't know if there's any objection to having it in the office. I mean, as long as we kept 6 foot distance.
Right.
And what?
And I have communicated a little bit with Betsy, and I told her we didn't have enough information yet, but I'm happy to meet with her and then bring it to the board, whatever we need to.
Okay, good. That's great. So
are we looking maybe like second week in November? That would put us out a month.
yeah. The 11th of November, that's a holiday, I think.
Yeah, 11th is Veterans
Yeah.
Day.
Yeah.
Is the following week too far out?
The week before Thanksgiving, then,
Right, so it would be November 18th would be the Wednesday.
I think you're better off meeting that first week in November.
Say that again, Barbara?
I think you're better off meeting that first week in November, the first full week before, like after Halloween, between Halloween and Veterans Day.
You think that's when we should be meeting?
Up to you. I'm just throwing that out. You don't want to go too late because I know it looked like personnel meets on the 14th of October. So you want to probably.
Is the water running? Can I go to the bathroom?
14th of November, right?
You know.
They meet on, I think, October 14th.
What do you
Okay,
want? Hold
all
on,
right.
hold on.
You want to kind of get something in a little bit earlier.
If we're in the second week, I have all day trainings all that first week of November, so I can't make it in a day.
Well,
but second week I could.
the
Okay.
13th might be an appropriate day, so let's
Yep.
go with that.
Friday the 13th.
Friday the 13th, yeah, no, no.
In the afternoon, like this time, 2 o'clock? Was that?
Dan
That's
was
fine.
joking.
But I'm fine with that. I mean, the 3rd is election day, the 11th is Veterans
Right.
Day. So Barbara made a good point about them meeting on the 14th. So like the 12th or the 13th works for me. It's fine.
Well, can we try to meet before they meet?
Right.
Barbara, you're meeting in October 14th.
I
Oh.
said October 14th,
Oh, okay.
its meeting is.
So that's next week.
Yeah.
You're going to be tied up all that first week in November, correct, Mary Lou?
I am.
Yep. Okay.
Could we go the 9th or 10th or something?
I think
9th
that,
or 10th,
because
9th,
that will be
12th.
before their next meeting, maybe, hopefully. 9th or
So either 9th, 10th, or 12th?
Yeah, did we lose Nancy? Is Nancy?
No, I'm here. Can you hear me?
Oh, yeah.
See me?
Do you have your
I just-
schedule out that far?
You know what? It should be coming out on Tuesday, and I didn't request those days off, so I might be on one of those. But I can see about making a switch if you want to pick one of those days.
Mary Lou, are you available on both days, 9th and 10th?
I am.
Hey, Dan, what's your schedule like?
For the 9th and 10th,
Mhm.
Yeah.
it's fine. Yeah. I'm free.
All right, so I'll get my schedule next Tuesday, and then if I'm not on either one of those days, we'll pick. Want to do that?
Okay,
Sure.
and is
All
morning
right, so I'll,
better for everybody or afternoon?
doesn't matter if I'm off, you can, to me, it doesn't matter.
Emily, is either day, one day better than the other for you, Monday or Tuesday?
It just depends. I can do either.
Okay.
I have like the regular state calls on Tuesday, but
Yeah, and those have been very informative calls, but
yeah, they record the first one, and the second one, there's someone who takes notes now and they send it out to everybody. So that's really helpful if you have to miss it, but
yeah,
I don't think we don't have to plan around
plan
that.
around it. Okay.
Okay. All right, so Tuesday I'll get my schedule, hopefully. Ugh. It'll be out.
And it'll be either on the 9th or the 10th, based on Nancy's schedule. And then Barbara, you can send a doodle poll. Okay,
You got it.
What time?
awesome.
All right.
All right.
The choices of the time, how's that? Either it'll be at 10 or at 2, is that okay?
Yes.
Okay,
Yeah.
Sure.
all right.
Okay.
All right. Thank you, everybody.
Thank you.
right.
Have a good
Meeting is
weekend.
adjourned.
Great.
Thank
Have a
you.
good
Talk to you
weekend.
later. You too.
Bye-bye.
Bye.
Bye, thank you.
Emma, I'll give you a quick call.
All right, sounds good.
How do I get out?